Right. Thank you, everyone, for joining us. This is the STD PCHD quarterly recipient call. As you can surmise from the title, we plan on holding these calls about quarterly, and they're mostly an opportunity for y'all to talk to each other and to us. We can address questions, but it's primarily an opportunity for y'all to share. I'm sure we'll have some short presentations and things like that. But mostly focus the time on your discussion. Today, we have a few items to go over. I want to introduce our new branch chief. We will review the bridge extension guidance, which was released on Friday. And then we will spend the bulk of our time with in discussion with y'all about how you're responding to the rescission of the DIS workforce funds. And just before we close out, we'll do a quick reminder of the Harvard Practicum project and take some questions. So without further ado, I would like to introduce Dr. Stanley Way. He's our new branch chief, and you can see some of his accomplishments here, and I'll let him take it away.
Sure. I guess just to say a few things about myself. Well, hi, I'm glad to meet you all virtually. Some of you I got a chance to meet at STD Engage, but I'm hoping to meet more of you individually. Just a little bit of my background. I am an internal medicine physician and preventive medicine physician by training. I joined CDC in 2007. I've worked on a number of different programs, but a lot of the time in HIV. And both domestically and globally. And I have spent a good amount of time in field type positions, 7 years between Mozambique and Atlanta Metro Health Department posting. So I have kind of seen this type of collaboration, the cooperative agreement collaboration from different angles, from being more in the field on the health department side and also being on the CDC side. And then I've also worked as a project officer before, so have some different perspectives on it. I work part-time as an STD clinician in the DC Health Department. I wanted to also say just a few things about my perspective on this collaboration. One is that having worked in the field and state and local, I know that oftentimes people who are working closer to the action have a better sense of what's needed. And I think if all we would do as CDC is sort of help you guys get to your goals, I think that would be most of what needs doing. So I see that as a major part of our work, just trying to facilitate you all getting to where you think you need to go. Because oftentimes you know better than we do what needs to happen in terms of disease control. Another important piece sort of along those lines is improving lines of communication. So things like this call, I think, are really important to have an open line of communication. On the slide, you see my email and my cell number. Please reach out to me if you have concerns or want to communicate directly. Another sort of theme of the kinds of things I'm interested in are building a strong linkage between data and program. And so making sure that, any data that we collect from you is actually useful for program improvement, and that we are using it for program improvement. Either we're using it or we're getting it to you so that you can use it more effectively, hopefully both. So that's just a few things about me and my perspectives, and I'll pass it back over to Jeff.
Thanks, Stan. And I apologize, I did not realize I was not sharing my screen there. So let me just say that we will review the extension guidance, move into our discussion, and have a quick reminder about the Harvard Practicum. Thanks, Stan. We're really excited to have you on as our branch chief. And with that, I will jump into the bridge extension guidance, which is what was released Friday, and it's the application for funding for February 1st of 2024 through January 31st of 2025. The main elements you need to think about for submission are the Peached Core Work Plan, update the objectives and activities, and we unfortunately we had locked the title page, the home page on that template, and so a revised template was sent today and loaded as a grant note. So please use that that revised template. My apologies for that. The year 6 budget narrative, just a note to include timelines for filling vacancies and prorate accordingly. That is one of the most common things that we see that is going to get your budget kicked back. So avoid that action item by including it up front. The year 5 mid-year report is part of this package. It is limited to just successes, challenges, and TA needed for the 5 different strategy areas of STD PCHD. So keeping that relatively simple. Please, though, give us the detail on what you've been able to accomplish, what has been a challenge, and what you need to work on. And as always, you need a cover letter signed by the principal investigator and the authorizing official. So you're going to submit as a supplement amendment, which is a little different than normal. It's not technically, it's not a continuing application, a continuation application. It is a supplement. So so you will follow the instructions here to go to Manage Amendments, click New, click Supplement, click Create Amendment. And then you're on the application control checklist page. There are online versions of the 424 and the 424A, and then you will upload the 4 elements that I just went over: cover letter, budget narrative, work plan, and mid-year report. All right. So before we move on away from the bridge extension, I just wanted to see if there were any questions about the bridge extension. And I think you need to raise your hand and we can unmute you. But please let me know if you have any questions about the guidance that was released Friday.
This is Lisa Lane from Ohio. Can I ask a quick question?
Sure.
Yeah, I'm just kind of curious. You mentioned specifically, this one's a little bit different because it's being it's being considered a supplement versus, like, I guess, a true extension. So how does CDC determine that, like in a situation like this, whether something is there criteria where the branch or the division says, well, we need this to be a supplement as opposed to an extension of the current budget period?
Lisa, I can't really tell you the criteria for that. What we do is say we want to extend for a 6th year of STD PCHD, and our grants management colleagues help us determine. They help us determine what that package should look like. And so I really don't have any details on exactly why it's a.
That's fine. I just was curious because with another grant out of your overarching center, they treated it as an extension and not like a supplement as you all are. So I was just curious. Thank you.
Okay. All right. Are there any other questions? Then with that, we will get to our discussion of the DIS workforce supplement and the very unfortunate rescission of of those funds. It's really an open forum to hear from y'all about how it's impacting you and how you're responding. There are some questions on here. They're really just to promote discussion. So don't be shy and take us in any direction. You can address any of these questions on the board, or simply speak from your own experience on the rescission and its impact. And don't make me pull up the participant list and start calling people out.
Jeffrey, can you hear me?
I can.
Okay, this is Dan George in Florida. How are you?
Hi, Dan.
Good.
Good.
So we have been using a lot of the supplemental funds. We're working with the University of South Florida to develop a entirely new DIS training curriculum to replace Passport to Partner Services. We have almost 20 modules already developed. They're working on the week-long curriculum, so we're really, really excited about that. I've looked at the modules. They're really they're interactive. They have quizzes in the middle of them, and so we're really excited about that. We feel like we went from rags to riches to rags again over the last several years. We are going to lose, as of December 31st, we're going to lose dozens of DIS that we hired, not as career service, it's full-time career service, but we call it in Florida other than professional services. So we were giving them these DIS an hourly wage, and they have been informed that their jobs will no longer come December 31st. And Stacy Swatz, our budget person, is on board. She could probably tell you a more precise number of DIS that we're going to be losing. And so as a result of that, we're probably going to have to scale back on what our priorities are. For example, I know there's other states that do not interview male syphilis cases that are asymptomatic. That accounts for a lot of our syphilis in Florida, and these high titers, if we just let them go by the wayside, that's kind of scary. On top of that, this year we've had the bicillin shortage, and we have put interim guidance out that only pregnant females receive bicillin because we are that short on bicillin. So there are a number of things coming into play here. We have good news that the curriculum will be developed. The bad news is we're losing a lot of DIS, and you know, so I mean, it is what it is.
That's really hard to hear. Is there no way to keep those folks on for just a little bit longer? I mean, we'll have the money available at least through the first part of 2025. So
I have been informed, and maybe we are entirely wrong in Florida, but we were told that the funds are done December 31st, but we could use any unspent 2023 dollars through June of 24. And again, we have Stacy Swatz, our budget manager. She may be able to shed some more light on that. So what I just heard you say is we have these funds through end of 25?
no, through the end of STD. The funds are available through the end of the core NOFO. So since we've extended the core NOFO to January 31st of 2025, all of the funds that have already been awarded to you are available. Years 1, 2, and 3 of the DIS workforce funding should be available to you under expanded authority to continue spending in that time frame.
Okay, Stacy, are you on? Please.
Hey,
Well,
Dan.
Dan,
Okay, Stacy.
Okay, yeah, I'm unmuted now. Hi, everyone. So yes, we are going to continue to use the funding that we have remaining. It's just that we may not have enough to retain most of the DIS. Yeah, it's just that we're spending and we just don't have the funds to continue with most of the DIS workforce staff past December. Right now, we're saying December 31st. If once we, take an account of what we have remaining before December 31st, we will consider, prolonging some of the staff that we have still in-house, whoever hasn't found another job, or we are trying to transition some of the staff to other funding sources also.
Yeah. And Jeff, just to be clear, we're not losing all of our DIS, only the ones that we brought on board in addition to
Right,
funded DIS.
right, okay. Okay. I want to address a few things that are coming up in the chat and in the Q&A, and Jessica Forsyth wrote that, while I'm happy to discuss these things, I'm also interested in what CDC plans to do to address the rescission. I appreciate the jurisdictional approach and want the federal approach to handle this. So there's not a lot we can do about the loss of the funds. That certainly hit us as hard as y'all, but one of the ways that we're trying to respond to it is extending Peached, and we're even in discussion about extending Peached to a 7th year in order to give people even more time to spend these funds. So we can't, I can't speak much to that yet, but that is under discussion and under advisement. So I see Dustin wrote that we're just exhausted and trying to keep our heads above water. I hear you, Dustin. It is confusing. And Erica Samoff in North Carolina writes about how it's hard to hire on funds that will end January 2025. Yeah, so I hope we'll have an answer for you about a 7th year of Peached soon. Jessica writes that we need that expanded authority in writing, please. So expanded authority is in writing. It's in the first notice of award that you receive every year. And then it's incorporated by reference in every NOA after that. So check the first NOA of the period, the budget period, and that is where you will see the language around expanded authority, because the DIS workforce supplement funds are part of STD Peached. They are available just like STD Peached funds are available. There's no difference in those funding that we need to call out.
Hi, Jeff. This is Karen Sarita in Texas. How are you?
Hi, Karen.
Hi. So we are, unfortunately, we just received notice from our funds coordinating monitoring branch, and they are interpreting subsequent as the next year. So we are in, so I know I've sent our new grant specialist, our GMS person, Ryan, an email late last week when we learned of this information. And so our agency is requiring stricter language so that we can continue to use that funds that we didn't expend in year 1 and year 2 into year 4, because they take it so our funds coordinating monitoring branch are under the impression that we have to use it the subsequent year, which would be this year.
Subsequent just means following,
yes.
So it doesn't mean
yes.
immediately following. And I think I've seen some of that email traffic, and we will work with you, Karen, to get that sorted out, and loop me in again if you're still having trouble with that.
Yeah, so I would thank you to Sophia for also responding, our project officer. Because we were not able to spend going back to your original question, because we were not able to spend funds or execute those contracts because we were decentralized to local health departments, we have the ability to continue to fund those new positions that were created as part of DIS supplemental in our regional health departments, as well as our 14 health departments that are supported under this grant or these funds. We are scaling back, and the positions that we have at central office. There's about 10 of them. Some of them we will not be able to hire moving forward, but we've had some changes at the state health department in being able to give employees a raise. So that has impacted all of our federal grants. But so thank you for answering that, and I will follow up with Anthony.
Okay, and I'm just going through the chat here, and I see you do have a timeline on when you would decide to expand to 7th year. I expect to know about that shortly. Just like when the division director put out a letter announcing the 6th year of Peach, we would probably do the same for the 7th year, and I hope that we'll have that answer soon. And yes, Andrew, you're one of the areas that has spent most aggressively, which is great, or was great, and now means that you've got less to work with here in the next year or so. Stacy Wynn asked if we will have to submit a carryover budget for expanded authority. So expanded authority does not require a carryover budget. You might need a carryover amendment if you are adding a contract or changing something like that. So if there's a big change in direction, there might be a need for that, but you can move 25% of your funds around, and as long as it's an activity that's already in an approved budget, you should be able to move forward with that. Feel free to interrupt me at any time, but there's a few more things in the chat if people haven't seen them. Michigan talks about planning a pediatric HIV STI unit. That sounds promising. I understand that you'd like additional specific wording on the unobligated funds, and I will work to get that. But that gets complicated here because it's already communicated. But I understand that it's not clear to everyone.
Hi, Jeff. This is Dakota from Jackson, Mississippi. Can you hear me well?
Yes, I hear you.
Great to see you, by the way. Thanks for the time and explanation and context. You kind of are familiar with the landscape of hiring here in Mississippi. And just generally speaking, should we exercise caution to filling and onboarding new staff using the existing awarded amount, given that we have pretty much zero uptake as far as we've not obligated outside of very little of the funds?
Yeah, I think if you've got a lot of money left over, you should be trying to pursue that aggressively. And I know it's hard to hire for a job that may only last for, 18 months, but I would say continue to move forward. Think about it as surge staffing rather than permanent staffing, perhaps. And that may change, how you hire or how you deploy people. But yeah, I think it's worth it to still try to bring some people on. You may not want to bring as many, but yeah, I think that would be appropriate.
Thank you. I just kind of wanted to, we're advocating. So I just wanted a little bit of voice of reason there. So thank you.
And looking at the chat, Allison Goldstein has a long post about the unfortunate situation they're in, where they can't release any unspent funds without a new NOA in hand. And yeah, that won't be available until we award these new funds. So yeah, the only thing we have is the letter that Dr. Mena wrote extending STD PCHD.
Hey Jeff, this is Juan. I'm Virginia. Can you hear me?
Yes, thank you.
Okay. So in Virginia, we're in terms of the impact on STD program priorities, we're still evaluating that. We will lose or likely lose quite a high number of newly onboarded DIS that have come on board through the DS Workforce Supplement dollars. We've also hired 6 new STD program coordinators to build up our training and onboarding program for new DIS and continue to provide support to existing DIS throughout the state. So those staff are, currently 100% funded out of the DS Workforce Supplement. We have immediately upon finding out of the rescission, we have put in a budget amendment request to our General Assembly. That will have to go through the process for the next state fiscal year. It is, uncertain as to whether or not we'll be awarded any funds, or if we are awarded funds from the state, how much that would be, if we would cover the whole, amount that was lost or not. So we're going to have to wait on that, unfortunately, until next year. So if the funding doesn't come through, I anticipate our program having sufficient funds to sustain the current staffing until conservatively mid next year, so about June 30th. After which we'll have to reevaluate, I think, STD program priorities. We're also experiencing, like many other states, increases in syphilis cases and trying to address that. So it's helpful to know that the unspent funds can be spent until 2025 now, but I think in Virginia we'll be out of money before then in terms of the DS Workforce Supplement. We're going to be looking at other, besides the request for state funds, we, which again is not guaranteed at all. We're also going to be looking at other potential funding opportunities, but those discussions are just starting, so there's nothing, certain at this point to try to mitigate some of the loss. And I'm thinking if nothing changes, we'll definitely lose a lot of staff. That's taken a lot of time and effort to train and onboard in Virginia.
This is Andrew from New Mexico. I want to share some similar information. So, our DIS team are all centralized in the state, and prior to this workforce supplement, we had a total of 17 positions and reached our all-time low of only 9 out of 17 were filled in June of 21 when this money was announced. We're now up to, I think, 25 or 26 filled positions out of 29. And really, with all this effort to rebuild, we luckily have a great back office and great leadership. So we created a sustainability plan through the end of our fiscal year, June 30th. And then we, like Virginia, have a supplemental request into our legislature, which I'm fairly optimistic about right now. Our state budget's looking pretty good for next year. And our secretary has made this a priority among all our funding asks. But I just think about the level of chaos around all of this. We have all collectively tried to recruit people into the field of what is a DIS and getting into this work, and everyone's doing something different. I think because the rescission was so sudden, there's not strategic planning in most places, including here, nor a federal level. And I wonder how many states are asking for a supplemental request, trying to use the increased STD and syphilis cases in their state as a justification, but we're all doing it individually. It doesn't feel like there's a national initiative because this just, we're barely 2 months into this bad news and all scrambling not to have a meltdown. But my DIS heard, we made an announcement after I got my interim plan approved by our leadership, like 2 days after we heard this news. We announced to all our staff that there would be no layoffs and no hiring freeze. And so we continue to move forward. But they're hearing from neighboring states and people around the country and colleagues they've met through trainings and conferences that other people are laying off. So there's still fear, even though that's not exactly our situation. But some jurisdictions can ask for state money. I see a lot of discussion about what's the national strategy. I know CDC can't lobby for money the way we can on the outside, but we need some discussion strategically among ourselves. I'm curious how many other states are asking for a state supplement and what the environment and what the justification is, not just, don't lay off X number of people. That's a bad thing to do, but why is this important?
Thanks, Andrew. Can we hear from everyone who's preparing a state request? You could, I guess you could put it in chat that you're preparing a state request, or please come off mute and talk to us. There's been a couple of couple of things in the chat. Puerto Rico is currently engaged in a review of its succession plan, as well as reallocation of DIS to other federal funds. We're actively aligning this with ongoing internal reorganization. Megan Evans asks, has there been any progress made in identifying new funding to supplant the loss of the DIS workforce funds? I know there were talks about the possibility of finding other funding, but haven't yet heard of any potential prospects. No, there really isn't a pot of money available to replace this. There are public health infrastructure grants out there to the states, and probably a lot of you are not involved with that because you had the DIS workforce dollars, but there may be a need to re-engage the people who are managing that infrastructure grant and see what possibilities there. So I see that Pennsylvania and Arizona, California, all looking at ways to maybe make a state request. In Wyoming, DIS workforce funds gave us what we always needed to move the needle. Testing has been up, and chlamydia and gonorrhea is down 2 years in a row. Well, that's really great to hear. It's great to hear, and it's also painful given the loss of the funds. We have not had any discussions that I know of with DHP. I'm reading Andrew Gans's comment in the chat about using more HIV funds. That is probably something we could look into, but I think it's also, about negotiating that at your state and local level. Illinois is also requesting state funding, and Texas is planning to submit a request, but you're in a biennial legislative session, so. Oregon is advocating for use of public health modernization and infrastructure money to be used to support DIS workforce, but don't have any control over that. And Megan Evans writes that Utah has met with leadership about both state funding and the public health infrastructure grant, and those are both up in the air. Ohio is looking to utilizing Ryan White rebates to make up for the funding loss. Shout out to Virginia for letting us pick their brains on how they do it. I know Ryan White rebates are not what they used to be, but that is something that could probably fit. I know in my own experience, we funded it under early intervention services as a part of Ryan White. And Wyoming is attempting to move workforce positions to other grants, but your funding is low. So yeah, floor level funding. Andrew Gantz says they're using program income, not rebates, to cover their interim, and also label it early intervention. Leslie wrote that some of the positions in Wyoming are split between Ryan White and DIS workforce. Please feel free to come off mute and say these things as well. I feel like I'm reading everybody's.
Hello.
Hi, Jeff.
Hi.
Hi, Jeff. This is Stacy. Can you hear me from New York
Yes.
State? I know that because our funding was, we have so much carryover funding that we plan on looking for other grants or acts in the state, but we think we can fund the DIS staff we have until 1/30/125. We hired about 16 out of the 25 right now. But yeah, it is kind of disappointing that we won't be able to fund them after that. But since we have so much carryover because things got late starts, a lot of our contracts that we can't execute now, that we're going to use the rest of that funding to fund them. But I know Rachel's not on the call right now. She's on vacation, but I know she's talked to other management staff and they're talking about trying to fund them on state grants.
Okay.
So
Okay.
we'll see how that goes.
And I see in the chat. Oh, go ahead.
Sorry, yeah, this is Samantha in Louisiana. We really struggle to get any state funds, so that won't be an avenue for us, but rebates are definitely what's going to help. And, we have spent some, but not all, so certainly that will extend it. But the other thing that I wanted to bring up that I know for us was incredibly helpful was monkeypox, and I brought this up in a survey that was sent out. Having any outbreak that comes up, these funds were absolutely pivotal and
Yes.
instrumental in ensuring that we didn't see more outbreaks. And so I think that's the other thing that's really, for me, making me nervous that we don't have other avenues, especially for that. And that, that's really frustrating.
It is, and it's so frustrating that we got the funds and then we're almost immediately able to prove that they were working by responding as well as we did to Mpox, and that is part of our arguments around this investment is worth it. So I hope people are able to use that in some way to help in their advocacy.
Yeah, exactly. I think seeing it work, that's what especially makes it difficult.
Yeah.
This is Leslie in Wyoming. Can you hear me?
I'm sorry, is that Leslie?
Yes. Can you hear me okay?
Yeah.
Wait, that might help if I didn't have it partially covered. Just in case it helps anybody else, before the DIS workforce supplement, we were using Ryan White funds to have outreach staff in some of our counties. And that was done through the local health departments. So they could do, the thing about it is it was hard to do a syndemics approach because of the restrictions on the Ryan White grant. So when they were strictly Ryan White, they could do HIV case management, and then they could do activities to get HIV cases identified, so testing, but that was specific to HIV and not other infections. So when we got the DIS workforce funding, treatment and I split the existing contracts 50-50 between Ryan White and DIS workforce so that staff could practice the syndemics approach. And
Yeah.
the thing about having it be outreach versus DIS in this case was they could reach out to get people tested, they could do the test, and they could treat the test and treat the people, and they could assist us with contact tracing as needed. So we did those three, we split in half, and then I did 4 other outreach contracts in non-traditional settings with the DIS workforce funding. I mean, altogether it's like 15 positions and 2 of them are DIS, but we only had 2 DIS to start with. Now we have 4, we'll be going back to 2 when we're out of money or we can't spend it anymore.
Thanks, Leslie.
Hi, this is George from Iowa. Can you hear me?
Hi, George.
Hi. Thanks for taking the time to listen to us all talk through this, Jeff. I did want to offer a little bit of perspective from Iowa. It kind of bounces off what several others have said here, but for a long time we have braided funding for our DIS staff with between STI or STD, HIV prevention, and Ryan White. So one of the strategies that we're working toward is to increase that braiding, so to speak, to try to stretch out the DIS supplemental workforce funds a little bit longer. We're fortunate that in Iowa we've been integrated with these other programs in our bureau for a long time, and I think that has increased and gotten better over time. So I do think we'll be okay in the short term, such that we don't have to let go of the positions that we've already built up. That was our first priority when these funds came out. We, just as the funds were intended for, build a bunch of positions both at the state and established contracts with our 4 largest counties for the first time who were doing DIS work, but we never gave them funds to do it. So they were limited by the amount of county funds that they could have to support their staff. So this has been tremendous help, and I've commented in some other venues that in our most populous county, we were able to give them 3 additional DIS, and that was one of the few counties where we saw a decrease in syphilis. So just hearkening back to the other comments about we can show these funds are effective and having these staff are beneficial, which makes it all the more tragic that we're losing the last 2 years of it. But we too are going to try a state request. I am not optimistic about it here. We are also in the midst of a merger with another department in the state. So public health is, I don't want to say competing, but there's more interests at bay than there were before that merger. And the last thing I'll mention that kind of relates back to what some of the other folks had mentioned, even though we have found ways to work with other programs in our bureau and not lose positions, at least at this time, our counties in particular are worried. So as they have positions that they're in the midst of filling, or people have just recently vacated, even though I've had conversations with them saying, these funds will still be available for another 1.5 years or so, or whatever it is, they are not wanting to fill those. So that's unfortunate, and I'm trying my best to try to convince them, but quite honestly, it's hard because I understand it takes a long time to train a DIS, and it is hard to recruit when you have that really known limitation. But in any case, I just wanted to throw those few things out there to say that, we're trying to work internally and with others in our state to do what we can, but it is real tough because I've been so happy with the impact that these funds have made, and to know that in the very best of scenarios, that'll be lessened if, and the worst, completely reversed is scary given what everybody is seeing with increases with syphilis in particular.
Yeah, thanks, George. It's well said.
This is Cherie from Philly. Just to kind of go off of what George was just mentioning too about staffing and things like that and training the DIS. For Philadelphia, all of our DIS are contractual DIS. So the turnover has been great. We're down to 3 DIS now, and we had to change our you know, the things that we're running, changing our
Reactor grid.
reactor grid and things like that. And I was sharing with my project officer when I was the DIS, when I came in, we had a mix of contractual DIS as well as federal DIS. So during that time, and I can see the advantage of that is having a contractual DIS, you know, they can come in today, get trained and leave tomorrow. But with the federal DIS at the time, it's not as easy just to walk away from, you know, being a DIS as a federal employee. So I was just wondering if that's something that would ever come back. We had one GS9 and she just left about a month ago. So I'm going to try to figure how we can replace that, or if CDC ever sees a way of bringing GS9 federal staff DIS back into play for the jurisdictions.
Oh, I definitely heard that on our recent site visit, Cherie, and that's definitely something that we will pass up. I think the contraction of that federal field staff has hurt, and if we can do something to promote DIS out in the field, then maybe that's something that we can take up.
Thank you.
Anyone else? I'm going to try to catch up on the chat. Arizona's funding DIS with Ryan White Early Intervention Services. Delaware, I think this is about making the case for the funds, is the disparity between STI rates and the ability of our current team to investigate, and the exponential growth of STI infections over time. We also cited the mortality rate of COVID-19 over 8 months and compared it to the training timeline of a DIS. Should we need to hire quickly in response to a new outbreak? Good. That's good, because that's training up DIS is not going to happen quickly. They need to be in place already, right? So.
This is Arizona. Another funding source that we kind of left out on tapping into was the ELC enhanced detection funding. That's ultimately it's going to expire in end of July 2024. But if you need to buy 6 months of time to 12 months of time, that's a funding source that we happen to throw a couple of cross-cutting DIS onto that pot of money, knowing that as we were spending down our unspent dollars, we would run out of positions. So the trick with that one, though, is we've gotten communication from the CDC partners that manage that funding pot of money that they're not really willing to add positions. So you have to make a really, really strong justification that we're just sustaining positions that were cut through DISW, because adding positions for an expiring grant is really tough. But we know that we have.
We lost you there, Rebecca.
Oh, sorry. My internet is a little unstable. But yeah, we have a chunk of change that went unspent during COVID that we're trying to use for a couple of our DIS positions, in addition to state funding, in addition to Ryan White funding, in addition to 181902 monies. So.
Thanks, Rebecca. Michelle Carlson asked if anyone is brainstorming a way to utilize HIV surveillance dollars to make up the loss. Do the funds that go into ELC grant for STI related projects come from CDC? They come from DSTDP generally, and then are pushed through the ELC mechanism. I don't think those funds would make much of a difference compared to the 400 million that we lost, though. We don't have any large projects going through the ELC grant. They're mostly pretty contained. Rebecca responded to Michelle that unspent dollars from 1802 are being used to sustain an EPI and a couple of DIS that do cross-cutting work funded by DIS workforce, but it's not a lot of money. Yeah. And Roger just agreed that CDC no longer assigning DIS through direct assistance and not replacing them with financial assistance has really hurt. Yeah, I know some of you have experienced that tremendously. So it's a hard hit. New York City has moved some of the DIS workforce to HIV grants, defunded vacant positions, funded some projects using other grants with accruals. Oops, and it disappeared. There it is. Compile information on grants issued through COVID-19 funding to project broader impact for us after those funds end. Paint a picture of the aggregated losses. So all of the funding that has been cut. Hopefully that will help with advocacy. Answering Michelle's question about surveillance money, Allison in Oregon says that they have zero HIV surveillance money to spare and are underfunded and unable to use their 1802 money to support the funding loss. And Jessica in California says 2/3 of our money goes to local health jurisdictions. Their situations are variable regarding other resources. It looks like 57% of them will not be able to find other funds after the extension ends. And a little more conversation about the change in the HIV grant year has stretched those funds, and a little discussion on carryover in HIV surveillance.
So Jeff, this is Beth. I think from Pennsylvania, one of the things that I think is really notable is that the rescission came out just 6 weeks after the FIG grant, that Public Health Workforce Infrastructure grant, had closed. I really fear, we're really trying to make sure for the supplemental funds that we've got, trying to make sure that we're trying to cover what we can for as long as we can. The sooner we know the next thing that's going to happen, the better. I'd hate to let folks go and then have to retrain up a new staff. So I think that's a big concern that just about everybody seems to be portraying here. And, when we've lost, at one point we had about 6 CDC staff assigned here to Pennsylvania, and mostly because we have a senior public health advisor that was supervising all of them. When we lost them, I asked for some dollars and I got, nope, no thank you, you can't have any. So this DIS workforce grant was a godsend for us to be able to expand our staff. And yes, we're hobbling together some Ryan White rebate, we're asking the state for money, we're doing all the things that just about everybody else is trying to do to make sure. But I think the biggest concern for most of us is loss. If we lose these staff after January of next year or the following year, will we be able to replace them quickly? The answer is no. Training up folks to be able to go out in the field to interview cases, to tell somebody they're HIV positive or let them know that they've been in contact with syphilis and need to be tested and treated, not easy, especially with the uptick of congenital syphilis as well. Telling a pregnant mom, very difficult. So I think these are really big concerns. And I think to that statement, I think, Dr. Wade, that's the biggest feedback that we could give you, is that we've got to start knowing before something happens, rather than this be like last minute, we're sorry this happened and sorry for your luck. I mean, I'm sorry, that's how it felt. So, and it's not on DSTDP, but I think this is CDC in its entirety, I guess.
I would say that it's very difficult to do a syndemics approach when we have no idea what the other one is going to do. So, STD changes per year, HIV changes per year, DIS workforce got rescinded. I mean, I don't know. I mean, as we were saying in the chat, HIV had us do a 17-month budget for 12 months of money, and we had to do salaries first. So there's no wiggle room in that grant. We were fortunate, and we had some unobligated funds that we did expanded authority with, and just barely covered what we really needed for 17 months. I mean, and now they say, I can't try to move something from DIS workforce to HIV because I don't know what HIV is doing. They sent something out, a grant note recently that just said, essentially, hey, we might be funding that 5 months, but then we've heard nothing since. So we don't really know, and we can't do the syndemics approach we're being asked to do because we don't have the information with which to make those decisions.
Yeah, that's a tough spot to be in. Beth, you have your hand up again. Just before you get started, somebody had asked a question about the time frame for the estimated remaining DIS supplement funds that's in the funding table for the bridge guidance. That was they asked us to put an estimate based on the drawdown. It's about a month old at this point, so it's not 100% accurate probably, but it is more or less the amount that you have to spend at least through January 31st of 2025. And including that in there, I think was kind of to reinforce, and there is a statement in the guidance that that you can spend these unobligated funds. So maybe that will help you with some of your discussions with budget folks around the use of funds. But it is in the guidance that you have approval to use those remaining funds. And I hear, another request to know the final answer on another year of Peached, and I think that's something that I'll try hard to get an answer on. And Cherie in Philadelphia reached out to HIV program and said that they're uncertain of their funding and are experiencing proposed EHE funding cuts and cuts to surveillance. So.
Hey, Jeff, maybe I'll just chime in because I hear the plea for us to tell you as soon as it's possible to tell you anything, and I think that's right. I think we'll do our very best to do that. In terms of the extending another year, so I will try to share as much information as we have. So in terms of that final year, it has been the decision has been made to pursue it at the center level. So not just my level, the branch level, or the division level, but at the center level, there's agreement to pursue an additional year. And then we're working with the grants folks to figure out, whether we can get it approved from that side. But I guess from the program side and like the technical side, there's agreement that it would be good to do it as long as we can, from a regulatory standpoint, make it happen. So just, I guess, to give you more information about the level of buy-in there is for that. And then, the larger issue about telling you things as soon as we know them, we certainly will try to do that. I'll acknowledge that sometimes we don't always know what's going on over there. Let's say in HIV over here in STI, and we don't connect the dots. We do try to liaise better, and we have liaisons in their meetings and then in ours, but we're not perfect, so we'll keep working at that. Thanks.
Thanks, Stan. That's hopeful. Becca in Arizona noted that they're worried about all of their COVID dollars expiring and that it's creating competition for state dollars. Yeah, makes it difficult. Megan asks, have there been any talks about changing the requirements for STD Peach since our funding is now stretched thinner due to trying to retain staff rather than putting money toward initiatives? That's a conversation to have with your project officer. There's, there might be some leeway in what you're able to accomplish, or if you really feel you need to change direction, there might be something that can do, but that's probably a case by case discussion. I was wondering if sorry for being late. I was wondering if the totals on the recent announcement for the DIS supplemental are current or were from the beginning of the year. Those are from about a month ago, I think. You're talking about the unexpended funds amounts that are in the guidance. And that was our drawdown from about a month ago, probably, and is so not just from the beginning of the year. Right. We have more comments. I know this has been disheartening and painful to face the fact that we're losing all this money, but I know that you are dedicated and resourceful, and I'm seeing that in the chat and in the discussion, and I hope we're able to succeed in changing plans. Rebecca asks, any idea what the DIS workforce metric reporting will look like in 2024, 2025? It's not real clear. Obviously, it will have to change, and as people run out of funding, there's less to report. So you might be able to stop reporting at some point. We are already, we already made some changes to get sort of a sense of how bad does it look for people that you've already hired in the current reporting. And we may keep some of that, but we're probably going to have to go through line by line and decide, what metrics are really make sense to keep reporting on. Thanks, Beth. Sounds like people might be talked out for now. So if that's the case, I'll give it another minute to see if we have any more final thoughts. I hope this has been helpful, and it's certainly helpful for us to hear from y'all. I think more conversation like this is something that we need, and we'll do it moving forward. And it won't always be such a crisis situation, perhaps, but maybe we'll be sharing some good news as well. So
Jeffrey from Florida, thank you very much. This has been very helpful. So thank you.
Yeah.
Thanks, Dan.
Thank you, Jeff. And can I say, I think especially the difficult part is I don't even feel like we got to enjoy having the money.
No.
We were so excited, and it was like spend, 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 spend.
Yeah.
And then we're here. And so even I think for people who have been here forever, not even getting to sort of revel in it for a little bit just feels sad. But again, thank you so much for listening and, knowing the struggles that everyone is experiencing.
Great. Well, thank you, Samantha. It's true, we didn't get a chance to enjoy it much, but let's savor it while we still have some. Just a final plug, evaluation team wanted to remind everyone that the program evaluation practicum, the STD program proposals are being accepted right now through September 8th. And if there was a communication about it not too long ago, a few weeks ago. Just a reminder, it pairs public health students up with STD programs and helps develop an evaluation plan and a project. And if anybody out there has experience in it and wants to give a testimonial, I would welcome it. Lindsay Vanderbush says, if you've not done it, do it. We had a great experience with the students. Yeah, I think everybody I've heard from a number of people that those are really valuable interactions. We also did in Michigan. Jessica's responding to Samantha. Yeah, just as we had projects ready to go off to take off, we got the cuts. If you have questions about the Harvard practicum, reach out to Dee or Kirsty, and they can help you out with the practicum. There is a grant note with the practicum application announcement and application form. Any final words, anyone? All right, well, I very much appreciate y'all out in the field doing this hard work, and this is definitely a tough topic, but I do want to thank you all for attending and being open to talk about it and work through it with us. So thanks, everyone, and have a great day.